So, Chris, thank you for being here with us. Can you tell us a little bit about the model of Waste to Wellness? How does it work?
Waste to Wellness is essentially an outcomes contract funded through a social investment bond and also funded by top-up funds from Big Lottery, Commissioning for Better Outcomes Fund and Cabinet Office Social Action Fund. Essentially the model is about social prescribing for people aged 40 to 74 with a long-term condition for which the GP has a register. And the reason for that is that we need people on GP registers because our commissioning support organisation is able to extract data from GP registers using a system called Radar, and it can then match that data against hospital episode statistics HES data.
Okay, and in terms of, if you look at your experience, what are the main constraints of using an outcome-based framework in the context of well-being?
I think in terms of an outcomes-based framework in the context of well-being, the biggest constraint in terms of, we're talking about social prescribing, the reason we focused on people with long-term conditions is that whether or not you get a long-term condition is often socially determined. Your outcomes, if you do, are certainly socially determined. If you think about somebody with type 2 diabetes, at one end of the scale, you have somebody with a lot of social, psychological, financial resources, high level of health literacy, give them a little nudge, and they go off and do all they need to do to improve their well-being. At the other end, you've got somebody who's unemployed, depressed, smoking, drinking too much, and they will need a lot of input to even think that they can improve their lives. And so the model is essentially around link workers. I think the constraint is, what's the time taken from an intervention to produce a saving? And what's a sensible time period to have within a contract?
How do you overcome this constraint?
We've two approaches. Essentially, our biggest repayment outcome is savings in secondary care costs. The argument that we presented to the commissioners was essentially this wasn't achievable within a short-term contract, so we needed a 7-year contract with the CCG for Waste to Wellness if we were going to have any hope of being able to show that we could make savings in secondary care from a social prescribing intervention.
Can you share some of the lessons that you learned in developing the Waste to Wellness SPV?
I think number of lessons. One essentially the CCG outsourced all of the development work, the procurement, contract management to a special purpose vehicle, which initially we set up within an umbrella organisation, Voluntary Organisations Network North East, which is a network for medium-sized to larger voluntary sector organisations across the northeast of England. They were interested in testing out an outcomes SIB-based model, and we were very fortunate in being able to put together a strong steering group with representation from the CCG, and we were able to appoint some consultants, particularly around financial management and finances, and other consultants to work with the voluntary sector and to develop an operational model. So being able to have a strong steering group and early meetings with the CCG to discuss what we were all about and how this fit within their long-term conditions strategy was an important part of moving forward.
Using outcome-based commissioning requires a cultural change, it is said. How did you manage to bring it about?
I think kind of an issue about sort of credibility and being around in the local scene. So local networks, local relationships, and being able to build on those local relationships and being seen as having credibility and being able to deliver and to do things differently is very, very important. I think parachuting in from outside would have been much more difficult.
Based on your experience, what are the advantages of using a social impact bond as a particular structure?
I think in terms of a social impact bond, the big issue is marrying the financial model with the operational model. And yes, we had a very long setup stage, about 4 years from initial idea to going live in April 2015. But that really gave us the opportunity to look at the model very rigorously. And I think for me, the big learning experience was the rigor that was required, both in terms of the operational model and how the operational model was going to work, and marrying that operational model with a financial model where we could demonstrate that there were potential savings. So looking at all of the existing data around long-term conditions within the local patch was an important part of all of that.
And what would be your top tips to a local authority who is wishing to engage in a waste wellness or similar social prescribing?
I think top tips is essentially is that you need to get a group of people together, and you need some specific expertise around finance. You need some specific expertise around operational modelling. You need to make sure you develop a management information system, because having the real-time data and being able to interrogate the real-time data about what's happening in the service, and to, where necessary, make adjustments and change the way you do things is incredibly important.